Hey everyone, welcome back for another deep dive.
Glad to be here.
Today we're going to be looking at Reda Sadki's new article, Artificial Intelligence, Accountability and Authenticity, Knowledge Production and Power in Global Health Crisis. And it really tackles a lot of big questions about AI's role in global health, especially when it comes to knowledge creation and power dynamics.
Yeah, and I think what's really interesting about Sadki's piece here is how he uses this really specific case study to ground all of these ideas. He introduces us to Joseph, who is a Kenyan health leader who's known for contributing really thoughtful stuff to this global health learning program called Teach to Reach.
Yeah.
And these contributions are based on his personal experience.
Right. And then things get super interesting because Joseph starts using AI to respond to these questions that are meant to get personal narratives from people.
Yeah, and that obviously caused a lot of confusion. People were so used to these really insightful personal stories from Joseph, and then all of a sudden they're getting these like really generic AI-generated responses.
Exactly. It really gets you thinking about what authenticity even means when AI can write like a person.
Yeah.
Sadki's really careful not to jump to conclusions here. He points out that Joseph wasn't like checking out of the learning process or anything. He was actually trying to use AI as a tool.
Right, and this is where Sadki connects Joseph's experience to the whole issue of accountability structures in global health. Health workers are under a ton of pressure from international donors. Their funding is tied to these performance evaluations, and there's this like constant fear of getting penalized if they step outside the box or take any risks.
So in a system that's all about following the rules and not rocking the boat, trying something new and potentially disruptive like AI can be pretty scary.
Totally. And that's where we get this transparency paradox thing. If Joseph had just said, hey, I'm using AI, people might have just dismissed his work as not authentic, even if it was good.
Right, but if he kept it a secret, he'd risk being accused of being dishonest and maybe even losing his funding. It's a tough situation. So how do you deal with that if you're working in global health? How do you balance being transparent with the fear of being punished for trying something new?
Sadki suggests that part of the answer is creating a culture where people can talk openly and experiment within global health organizations. It's about creating spaces where people feel comfortable sharing their experiences with AI, both the good and the bad, without worrying about being judged or punished.
And it seems like part of that is rethinking how we judge the quality and authenticity of knowledge in a world where AI is playing a bigger and bigger role in creating it. What makes something valuable? Is it where the ideas come from? Is it the process of how they were created?
Yeah.
Or is it the impact they have? These are questions that Sadki doesn't necessarily answer, but he definitely brings them up.
Yeah. He also points out the limitations of systems like this Teach to Reach program. They weren't built to accommodate AI, so Joseph didn't have a way to explain what he was doing or separate his own insights from what the AI was generating.
It's almost like the system itself encourages people to keep things quiet.
Right. And that's something we need to fix if we want to use AI in a way that's both responsible and helpful.
Now, Sadki also talks about the economic side of AI in global health. He brings up OpenAI's announcement of these specialized AI agents that can do all sorts of complex tasks. Basically, they're like digital knowledge workers.
And when you compare the costs, it's pretty wild. Sadki says a high-level AI agent might cost $20,000 a month.
So it's easy to see why global health organizations that are facing budget cuts and pressure to do more with less would be interested in these AI agents.
Absolutely. But Sadki says we can't just look at this from a purely economic standpoint. He says we need to think about the bigger social and ethical implications of replacing humans with AI, especially in a field like global health where relationships, trust, and local knowledge are so important.
And that brings us back to those power imbalances that we talked about earlier.
Exactly. Sadki highlights how historically there's been this labor stratification in global health, where people in the global north have often been paid way more than their colleagues in the global south. So the big question is, will these AI agents just make those inequalities worse? Will it lead to a situation where the people who can afford these fancy tools have even more control over knowledge and decision-making?
It's a serious concern. And it connects back to Joseph's story. Sadki suggests that maybe Joseph trying to use AI could be seen as a way of pushing back against those power structures.
That's a really interesting take. Joseph, by trying to get his hands on these AI tools, is challenging the limitations that have been placed on him and other practitioners in resource-constrained settings. He's trying to even the playing field to access knowledge and capabilities that he might not otherwise have.
And that highlights another important point that Sadki makes. We need to be really intentional about how we bring AI into global health. It's not just about using the newest tech. It's about using it in a way that matches our values and that promotes fairness and justice.
Absolutely. And that's where Sadki's framework for AI and global health comes in.
So before we get into that framework, can you give us a quick overview of what it involves?
Sure. So Sadki has put forward this framework that sees AI as a coworker, supporting networked learning and local action. It's not about replacing human expertise, it's about making it stronger. It's
Mm.
about building systems where AI and humans work together to solve these really complex global health challenges. And a really important part of that framework is this focus on local action. It's about giving communities the power to use AI in ways that actually meet their specific needs and address their priorities instead of just having solutions imposed on them from the top down.
That really connects with what other researchers like Friwa and Vofadize have been saying about the importance of making sure AI fits the context in global health. You can't just take some tool that was developed in Silicon Valley and expect it to work perfectly in a rural village in Kenya.
Exactly. Context matters. Cultural norms matter. Existing power dynamics matter. And that's why Sadki emphasizes this participatory approach to developing and implementing AI. It's about getting communities involved, listening to their concerns, and making sure that AI is used in a way that benefits them, not just the institutions or companies that created it.
That all goes back to Sadki's main argument about knowledge production and power. He's basically saying that AI could either make existing inequalities worse or it could help dismantle them. It all comes down to how we decide to use it.
And that choice requires a deep understanding of the ethical considerations that are at play. Like, how do we make sure that AI algorithms don't just perpetuate existing biases? How do we protect the privacy and confidentiality of sensitive health data when it's being used to train AI models? These are questions that Sadki doesn't necessarily answer in this article, but he definitely raises them as really important points for further discussion.
And he suggests that part of the solution might lie in what he calls algorithmic literacy.
Right. Algorithmic literacy is about developing a critical understanding of how AI algorithms work, their limitations, and their potential biases. It's about being able to evaluate the outputs of these algorithms and to use them in a way that aligns with our professional and ethical values. And that's so crucial for anyone working in global health, not just data scientists or computer programmers.
So it's not just about knowing how to code or how to build an AI model.
Yeah.
It's about understanding the bigger implications of using AI in a healthcare setting.
Exactly. It's about asking those tough questions. Where is the data coming from? Who is benefiting from its use? And who might be harmed?
And it's about being able to explain those things to the people who are most affected by these technologies, the patients, the communities, the health workers on the front lines.
Which brings us right back to that issue of transparency and accountability that we were talking about earlier. If we're going to use AI responsibly and ethically, we need to be able to have these open and honest conversations about its limitations and potential risks.
And that transparency, but needs to go beyond just the technical side of AI. It also needs to include the economic and political forces that are shaping how it's developed and used. Who's funding the research? Who's profiting from it? And whose interests are being served? These are questions that Sadki wants us to really consider.
And that leads us to another key part of Sadki's framework, this idea of networked learning. He argues that AI shouldn't be seen as a replacement for human collaboration, but rather as a tool for enhancing it.
So instead of isolating individuals in their own little bubbles of expertise, AI can be used to connect people from different disciplines and backgrounds to facilitate knowledge sharing and to promote collaborative problem solving.
And that's especially important in global health, where the challenges we're facing are so complex and interconnected. You need epidemiologists working with anthropologists, data scientists collaborating with community health workers, policymakers listening to the voices of those most affected by the issues.
It's about recognizing that no one person or discipline has all the answers, and that the best solutions often come from bringing together diverse perspectives and experiences.
And Sadki sees AI as something that could potentially spark that kind of network learning. He imagines a future where AI tools are used to break down silos, to connect people across geographical and disciplinary boundaries, and to facilitate that cross-cultural collaboration that's so essential for addressing global health challenges.
But he also acknowledges that this vision comes with its own set of challenges. There's the risk, as we've discussed, that AI could make existing power imbalances even worse. There's the need to make sure that AI tools are accessible and usable by people from all sorts of backgrounds and skill levels. And there's the ongoing challenge of building trust and understanding between the people who create and use these technologies and the people who are most impacted by them.
And that's where Sadki's emphasis on authenticity really comes in. He argues that if we're going to use AI in a way that truly benefits global health, we need to make sure that it's grounded in a deep respect for human experience, for local knowledge, and for the values of equity and justice.
It's about using AI to make human voices louder, not to silence them.
Exactly. And it's about recognizing that technology is never neutral. It's always shaped by the values and intentions of the people who create and use it.
So ultimately, the question isn't whether AI will transform global health, but how it will transform it. And that's a question we all need to be asking ourselves.
And Sabi's article gives us a really valuable framework for thinking through those questions and for making sure that AI is used in a way that aligns with our values and that contributes to a more just and equitable world.
It feels like we've just scratched the surface here. There's so much to unpack.
Oh, absolutely. Saki really covers a lot of ground in this piece.
And he's not afraid to point out the potential downsides of AI in global health. Like he specifically talks about this risk of creating an AI divide, where all the benefits of these technologies mostly go to rich institutions and individuals, and the people in resource-constrained settings get left behind.
Right, and that goes back to what he was saying earlier about that historical labor stratification in global health.
Exactly. If we're not really careful, AI could just make those existing inequalities even worse. We could end up in a world where knowledge and decision-making power are even more concentrated in the hands of just a few.
And that's why Sadki's framework is so crucial. It gives us a way to think about how we can actually use AI to promote equity and justice instead of reinforcing those power structures.
I'm really struck by how much he emphasizes local action and network learning. It's a good reminder that AI shouldn't be this top-down solution imposed by experts from the global north.
Definitely. It needs to be driven by the needs and priorities of local communities, and it has to be implemented in a way that gives them the power to take ownership of these technologies.
That really reminds me of what Newton Lewis and her colleagues have written about performance management in complex adaptive systems. They argue that traditional approaches, they often miss the dynamic and interconnected nature of health systems.
Right, and they suggest that we need to move away from these rigid top-down metrics and instead focus on more flexible participatory approaches that really value local knowledge and experience.
So how can we actually use AI to support that kind of shift in performance management? How can it help us build systems that are more responsive to the needs of communities and that actually empower them to take an active role in shaping their own health outcomes?
That's a fantastic question. And I think it shows that we need more research and experimentation in this area. We need to explore how we can use AI to make collaborative learning easier to support community-based data collection and analysis, and to create those feedback loops that allow for ongoing adaptation and improvement.
And we need to do all of that while still keeping in mind those ethical considerations we talked about earlier. Making sure that we're using AI in a way that respects human rights, promotes equity, and protects the well-being of communities.
It's a big challenge, but I think it's one that we absolutely have to tackle. The potential benefits of AI in global health are huge, but we can only realize them if we use this technology wisely and with a real commitment to social justice.
Sadki's article definitely gives us a lot to think about. It's a call to action for everyone working in global health to have these important conversations about AI, to push for its responsible use, and to make sure it's used in a way that benefits everyone, not just a select few.
You know, that last question he asks really sums it up. As AI becomes more integrated into global health, how can we ensure it supports knowledge democratization and equitable progress rather than reinforcing existing power imbalances?
That's the question I want to leave you with as we wrap up this deep dive.
Yeah.
How can we each in our own work and in our own spheres of influence help create a future where AI is used to build a more just and equitable world?
It's a journey that will take ongoing dialogue, critical reflection, and a willingness to challenge the way things are. But in the end, I think it's a journey worth taking.
Thanks for joining us on this deep dive. We hope it sparked your curiosity and inspired you to explore these issues further. Until next time, stay curious and keep learning.